I'm Monica Ruiz. I'm an associate professor in the Department of Prevention and Community Health at George Washington University in the Milken Institute School of Public Health. The overall study was looking at the impact of policy change as a structural intervention for HIV prevention. What this means is policy change is an environmental factor, a structural factor, something that's not tied to individual behavior, but when we do things like change policies that allow people to do the things that they need to do to take care of their health, it can have an impact on new HIV diagnoses. That's exactly what I was looking at in DC, in Baltimore, and in Philadelphia. The policy change specifically that we were looking at was the change that allowed legal syringe exchange to happen in a city. So in Philadelphia and Baltimore, both of those cities had to go through a change in legislation to allow legal syringe exchange to happen in those cities so that they could give clean needles and syringes to injection drug users in those cities for HIV prevention purposes. Our findings for both cities were quite exciting. In Philadelphia, there were almost 11,000 infections averted over 10 years, which is super exciting when we think about how many people who could have been infected that actually were not infected. In Baltimore, there were almost 2,000 infections averted over 10 years. Again, super exciting in terms of the number of people who are not living with HIV now that could have been had that policy not changed. Public health officials, in many ways, I hope that this study and the results from my DC study, which also showed similar exciting findings for infections averted, can be used by public health officials as evidence that these programs work. And not only do these programs work, but we need policies in place to support the implementation and the sustainability of these programs. We may not see something immediately, but over time, these infections averted add up. What this means is benefit for the public health, benefit for the healthcare system, and benefit for communities, especially those that are really, really marginalized and really don't often see public health efforts being paid attention in their direction. The next step in this research is to look at other structural factors that influence drug user health. Right now, I'm working on collecting some pilot data for a study looking at the impact of gentrification on drug users' access to medical and social services. This is super important, especially in a city like DC, but also in other cities where we see gentrification happening. And while this is great for tourism and economic development of a city, it also has the side effect of pushing people out of cities that can no longer afford to live there and pushing them out and farther away from the healthcare services that they typically have been accessing. So when people can't access healthcare services, what happens to them? How does it affect their stability? How does it affect their ability to take care of their health? It's so important to look at the evidence on this. There are so many people who have beliefs about drug users and that drug users can't possibly care about their health. Otherwise, why would they be using drugs? That's really not the case. Addiction is really hard. Addiction is a terrible thing to struggle with, and people, although they may have an addiction and may be struggling with addiction, they still want to be healthy as much as possible. Yeah, until they're ready to receive treatment or to stop using, whatever it is. And so to think that this is a population that doesn't deserve our attention is completely wrong. And so I'm hoping that folks look at this evidence, they look at this research and say, hey, I may not agree with that, but we should do this for other people. This is something that benefits public health, and we should have public policies that are based on evidence, supported by the scientific evidence, that benefit the broader community as a whole. In that way, everyone wins.